So, so today's focus is going to be on pet health, but in July, we're going to focus on plant health. Our technology has been used, and we published many papers on understanding plant metabolism. And one of the things is our technology can be used to actually discover the right nutrients for plants. Plants in the United States suffer a lot of topsoil depletion, and typically what they do is fertilizer, but we think there are other ways. But anyway, but today we're going to focus on pet health, and we're going to look at a whole systems approach, and we're going to also talk about one of the solutions, K9701, which we'll talk about towards the end. So let's begin. Next slide. So anyway, this is Dr. Shiva Ayyadurai. My background is I hold 4 degrees from MIT. My PhD is in a field called biological engineering. That department at MIT was really started in 2003, before it was known as the Department of Food and Nutrition Science. And the Department of Biological Engineering was created to support the advances in biology, just like chemical engineering was created to support the advances in chemistry. So it's a very new field, but it's really about using all different approaches to really take advantage of discoveries that we're making in biology. Next. So next slide. So we want to talk about today everything we do at CytoSolve or Truth Freedom Health, our movement, or Systems Health, which is part of the VA-SHIVA overall framework, is we want to educate people on science. In today's world, if you do not take a systems approach, which is what we pound away every day, you're basically going to get fooled into reductionism or some aspect of a fake science, or following some foolish politician who really is in one wing or another, and ultimately not getting anything having to do with your health. As you know, our movement, there's all this stuff about Fauci now 4 years later, but it was our movement, it was my work in 2020, which exposed Fauci, ran the Fire Fauci campaign. And now you have all these grifters grilling Fauci. Trump gave him a commendation award. But all of this, none of these people told the truth at the right time. With our technology, CytoSolve, what we do, we're always able to tell the truth at the right time when it matters. So telling truth at the wrong time is as bad as not telling the truth at all, because it means you were opportunistic. So CytoSolve uses that systems approach, and we're going to focus on pet health. And then we're going to talk about, Prabhakar, can you fix that? It says pet health, not pet health, in that fourth bullet. And Prabhakar is going to fix that, yeah. So we're going to focus on pet health, and then we're going to go into talking about how you can actually support everything we do. Next. So, Prabhakar, can you play a video? Dr. Prabhakar is going to play a video so you understand the journey to systems. And this is right on the VA-SHIVA site. So as people are coming in, my journey to creating CytoSolve and the systems approach we take. Prabhakar, we don't hear it. Prabhakar, we don't hear it.
Shiva begins in the chaos.
Yeah, can you start at the beginning?
Welcome to VA-SHIVA. VA-SHIVA is a product of my journey across East and West, science and tradition, ancient and modern, that brings you the science of systems so you can become a force for truth, freedom, health. VA Shiva is a platform of revolutionary education, community building, and weaponry for unleashing local activism. My journey to VA Shiva begins in the chaos of Bombay, where I experienced diverse religions, languages, castes, and in a small village that had no running water, no electricity, where my grandmother, a poor village farmer, practiced Siddha, an ancient system of Indian medicine over 10,000 years old. She observed one's face, the art of Samudrika Lakshanam, to understand a body's unique constitution, allowing her to deliver the right medicine for the right person at the right time. Watching my grandmother heal others, I was inspired to study medicine, but I was also aware of the corrupt caste system of India, which denigrated a human being, where my family were considered low caste untouchables, where one's birth determined one's destiny. The grit and determination of my mother and father led them to get educated and to come to America, a 1 in a trillion event. Their actions inspired me to work hard and excel. While in 9th grade, I attended New York University in a computer science program, and subsequently, at the age of 14, was given a full-time job as a research fellow at what is now known as Rutgers Medical School in the heart of Newark, New Jersey. There I investigated the system of sleep using mathematics, computer science, and biology for sudden infant death syndrome. It was there in Newark where I invented email, when I was the first to convert every feature of the physical, paper-based interoffice mail system, including inbox, outbox, memo, carbon copy, blind carbon copy, attachments, into its electronic equivalent, a system which I named email, a term that I was the first to coin. On August 30th, 1982, I was awarded the first U.S. copyright for the invention of this system, recognizing me as the inventor of email. At that time, copyright was the only way to protect software inventions. I went on to MIT, where I earned 4 degrees across multiple systems of engineering: electrical, mechanical, design, biological. That training led me to invent many other systems for advancing humankind. EchoMail, the world's first intelligent email management system. CytoSolve, a computational biology system for eliminating animal testing to discover new medicines faster, cheaper, and safer. And to the creation of a whole systems methodology for certifying clean food. These innovations led me back on a Fulbright to India, where I discovered the missing link between Eastern medicine and Western systems theory, honoring my grandmother, to develop Your Body, Your System, a powerful tool that will help you understand how your body is a system and how the inputs of food, supplements, and exercise bring your body back to its natural system state. And Systems Health, an integrative educational discipline that is now integrated into the VA Shiva platform that will enable you to learn the science of systems, the science of everything, be it your body as a system or our society and politics as a system, to reveal the foundational interrelationships between truth, freedom, health. Now is the time for you to be the light, learn the science of systems, build community, and weaponize yourself to unleash the activism necessary to deliver truth, freedom, health in your local community. Welcome to VA Shiva.
All right. So very briefly, to those of you who are new, next slide, the infrastructure that we built and the education we do through all of our programs is to enable citizens of the world to think, fight, and heal. And so it's a part of that through solution we have on the fighting side, which is leadership. Next slide, is Truth, Freedom, Health. Next. And we've created an entire leadership institute, which we recommend everyone go check out. It enables you to go end to end from understanding, from looking at the confusion in the world to understanding how the world operates, how you can be a part of the change, and then lead other people to change. So that's our leadership training institute next. And then every Thursdays, we have our Systems Health educator program. So every other Fridays, we do our Systems Health Institute, where we're training professionals to become health educators next. And then the Open Science Institute is what we're talking about today. That's where we enable all of you if you want to do research through our platform, and at the same time we share research. Next. This is a part of the Truth From Health Institute. You can go to truthfromhealth.com. You can come to our open houses, which we host every Thursdays at 11 a.m. and 8 p.m. We have one coming up day after. You can go to vashiva.com/orientation, sign up. Relative to the Systems Health program, next, we have our entire institute where we're training thousands of people across the world as professionals into this very large, it's almost going to be around a $30 to $50 billion market for health education, where you can become a systems health educator. So we have, this is an old slide, May 24th. Our next one is in June. That's coming up. June 2024, we have an event coming up where we do our Systems Health Summit. Next slide. And then you can attend our Systems Health program, our tutorial. There's one this Friday. Prabhakar, go back, please. Go back to the Systems Health thing. You can go to vashiva.com/tutorial. You can sign up if you want to really get an understanding how the body is a system and how you can also become a systems health educator. And then finally, today, we're focused on CytoSolve. And the CytoSolve is actually a technology platform that came out of my research at MIT, but we've made it into something we want to share with the public. And then every first Tuesdays, we do this symposium, and we have different topics. Next. And if you want to propose a topic, feel free to do so. So let's start with pet health. Here's some of the background on it. Let's jump right into it. So we want to just share with you a little bit about what CytoSolve is. So when we created CytoSolve, our mission was to really revolutionize health, not only for humans, but for pets, for plants, everything, to figure out what works in a holistic and a systems-based manner without the need to kill animals, through using the computer and using discoveries in biology. So that's why we built CytoSolve. Next. As a part of that, we contrasted that to the way that big agricultural companies and big pharma companies and big pet food companies actually do development. The way they do development is to develop what are called pharmaceutical drugs or interventions, which are very, very costly, by the way, to develop. Takes 13 years, $5 billion, and this is the process. So if they're, let's say, building a Lyme disease for animals, they find some compound, they do in vitro screening, then they go kill a bunch of animals, and then they go to phase 1, phase 2, phase 3 clinical trials. What's interesting is that in this process, there's a serious effort to discount stuff that comes in nature. Prabhakar, is my voice still breaking?
No, it's better.
Hello?
It's
Okay.
better now.
Okay. Not sure why. Tell me if it is, okay? If it
It's
happens
good
again.
now.
Okay. So this process of developing a drug or developing synthetic compounds is a very costly process because you're trying to mimic nature. And this is why most drug companies, whether it be for developing stuff for pets or animals, have been failing. As you can see in this next slide, they spend a lot of money on R&D, and even the FDA is not approving new drugs. This is why they really needed Donald Trump to really push the vaccine mandates, because the vaccines were the way they could make it out of their death spiral that pharma companies were under. Now, there are many products that come from natural products that are ignored because they're much cheaper, and they've made it difficult to validate these products. And that's where CytoSolve comes in. Our technology helps us validate natural products, which are not based on one compound. Next. So the entire effort of big pharma is what I call the big elephant and the blind men. The elephant is, let's say, Lyme disease, or the nutrition of your pets, or any disease. The way they approach it is the individual blind men here touching the elephant, let's say that's cancer or some disease, are just looking at pieces of it, not in a connected way. So if they were ever, so the way they would come up with the elephant next would be look like this. They would think the elephant was a snake connected to a fan, connected to a rope, because they're all looking at parts, which is nothing what the elephant looks like. But this is the unfortunate reality of the reductionist approach. The only way out of this is a systems approach. Next. So, and by the way, this reductionist approach is how we used to build airplanes. You created a design. You didn't really know the full mechanics. You threw a pilot in. If he died, you said, oh, geez, he died. And if he succeeded, then you try to explain why. You didn't go to it understanding fundamental, principles. Next. So there was a need for a revolution, as I think we can go through this a little bit quickly, as everyone knows that I wanted to take a systems approach, and I have a history of doing this. Years ago, 40 years ago, I used to do research on integrating computing with biology to understand why babies were dying in their sleep. Next. And we were able to understand the sleep cycles of babies and interconnect it to their breathing patterns, and then be able to create alert systems. So that's a way of connecting two areas, sleep cycles plus breathing, and then, technologies to save babies' lives. Next. Email, as I mentioned, was also a system. Email is not the simple exchange of text messages. And as we go through these slides, you'll see that email is a very complex system of the memo. And I was the first in the world to convert this entire system into the electronic version, and also named it email, and got the first US copyright at a time when that was the only system way of protecting software inventions. Next. So my experience in medicine and systems alerted me to the need that we needed to create a systems approach to medicine. When the Genome Project ended in 2003, we recognized we have the same genes as a worm. Next, and this led to the realization in 2003 that if we're going to understand a whole being, a whole organism, it's not just about the genes. We needed to interconnect across scale and time. Next, spatial scales and temporal scales. So this resulted in one of the grand challenges, which was we need to move out of the nucleus, and we need to start understanding the whole cell as a system of interconnected molecular reactions. Because if we could do that, we could eliminate the need for animal testing, we could test combination therapies, et cetera. So that became the base of my PhD work. Next. And so that resulted in the creation of CytoSolve, which would take these little ball and stick diagrams, which are all over the literature in science, interconnect them to create mathematical models. Next, which could accurately predict complex phenomenon like this. Next. And that's what we really needed. Next. So what I had created was CytoSolve, which could, and it's really, if email was the electronic version of the interoffice mail system, CytoSolve is the electronic version of the cellular molecular system. Next. So using CytoSolve, it took me about 3 years to publish this paper because this was such a revolutionary breakthrough. People didn't think anyone could do this. So when you're dealing with the establishment scientists, they force you to go through a much longer process. And this is why we've taken CytoSolve out of the university and brought it to all of you, because as you'll see, we've proven its efficacy as a very powerful platform. Next. So CytoSolve allows us to, this old model of drug development, next, where they just, half-bake things. The new model is we could take complex compounds, combinations of compounds. I'll give you an example. There is a weed that grows in my lawn called Japanese knotweed. And there's a very there's an interesting thing that in nature, it appears that wherever you are situated, in traditional cultures, within a 1 mile radius of use, all the plants that can heal any type of ailment you or your animals can get. So Japanese knotweed is interesting because it is a base of creating a supplement called resveratrol, just out of using one compound. But the combination of compounds actually cure, guess what? Lyme disease. And up here in the Northeast, we have a lot of Japanese knotweed. Well, we're told it's an invasive species, it's horrible, cut it down, right? What's interesting, because if you have dogs who are getting Lyme or you're getting Lyme disease, Japanese knotweed is right there. Well, Japanese knotweed is, if you want to use it, you have to use the leaves, the roots, the stems, which means it has many, many compounds. And so with CytoSolve, we can take all of those compounds, understand it without killing animals, and let's say come up with something that's a natural combination of compounds for curing Lyme, okay, killing the spirochete. Next. So that's an example of what we can do with CytoSolve. Next, handling combinations. Next, Prabhakar. And this is how we build airplanes. We don't simply throw a pilot in an airplane anymore. We use the computer. We don't kill animals. We do everything on the computer. And that's what CytoSolve is. It's a breakthrough. Now, this breakthrough, the typical way, Prabhakar, go to the previous slide, that you, no, previous slide, Prabhakar, yeah. So the typical way that you get a technology like this out there is you stay within the swarm. You have to rely on them for funding. And then you have to, they give you funding. And then based on that funding, then you give up your ownership of a company and they direct the use of that technology. I didn't want to do that. We wanted to bring CytoSolve to the world, to all 8 billion people. So I could have sold out, but we didn't do that. We have methodically built CytoSolve, albeit in a slower way because we had to fund it ourselves. And over the last 16 years, as you'll see in the next slides, we have proven the viability of CytoSolve, but it requires you to now get involved. Given that we have done this for you, for all of you, you guys need to support this work. Because, and we've made it, we can do research at 1/1000th the cost of what other universities do. So part of what we're going to be talking about as we talk about pet health is how can you help? How can you help support this work? So this technology is truly a technology for the people. And so you see, we call it a collaboratory. Okay. So I think there's a novel platform for collaboration. Rebecca, can you fix that? A novel platform. Go back. I don't like these. Yeah. If you can just fix that. It says a novel platform. I think you want, what we want to say is, I just want to make sure we're not sending you any inaccurate information. Nope, further down. 1 second, everyone. Yep. So there we go. It's a platform for collaboration. So on the far right, we have the ability, can you go to full screen, Prabhakar? We have the ability to take, nope, previous slide. In any field. Nope, next slide. Nope, previous slide. Right there. So we have the ability to take research, mine that research, interconnect the molecular pathways, build models, and share it. Now, for the last 16 years, we've been sharing it with the research community. We're going to share all that with you, which is what we do. That people can participate and support this feedback process. So think about what we've created. We've created a powerful platform for citizens-based science. We've done our work. Now it requires you guys to get involved. Next. So we have a process where we can take any problem. We look at all the science done in that area without cherry picking. We identify molecular pathways. We organize them. Then we integrate them. And then we create models which we can use for testing without the need to kill animals. Next. Now we work with, we had to go prove ourselves. So we've worked with universities, pharma, biotech, functional food companies, foundations, and government. And so what we've shown is our technology works. And in fact, the establishment journals have published us, which means that they can't later on say that, oh, this stuff doesn't work. We've actually gone toe to toe with the establishment and shown that we can compete. And we'll give you some examples. Next. So here's an example that we're going to show you. Next slide. Prabhakar, can you go to the next slide? So this technology has been used in many, many different areas. Next. Without us even going there. People have come to us and used it in different areas. Next. So, for example, in the field of neurodegenerative diseases, which is like Alzheimer's, Parkinson's, ALS, brain cancer, we have used CytoSolve Next to do the understanding of one of the most important functions of your brain, which is called the blood-brain barrier. So what you're seeing is the vasculature in the blood-brain barrier, which is composed of the endothelial, the astrocytes, and the pericytes, which is an interesting cell, which, by the way, gets attacked by the spike protein. And using this anatomy, next slide, we have gone through all the literature and we've mapped out all the molecular pathways in the endothelial, in the pericytes. Next slide. And then in the astrocytes. And then because we take a systems approach, one of the important contributions that I made in this work was to create a molecular systems architecture. What this means is in the engineering world, I don't view disease as a disease. I view it as a dysfunction in a particular part in the system. Western medicine likes to put everything as a disease because when you label it as a disease, and you can create a drug for that disease and sell a lot of stuff without ever focusing on the underlying mechanism. So in the top layer, we have diseases. The next layer, we have the different signaling mechanisms. At the bottom layer, we have the anatomy. No one had ever done this before. Now, I'm not a neuroscientist, but this was a major contribution. And Nature Neuroscience isn't probably the #1 paper journal in the world to even get published in. So this was a major, major hit for CytoSolve. There's been over 1,000 citations of this paper now. Next. And by the way, you can go ask any of the swarm scientists, hey, Dr. Shiva is published in Nature. And you'll get a lot of jealousy out of them because it takes a fraction of the scientists of the world ever get to even publish in Nature. Next. So the point is, we published in Nature and we have validated CytoSolve. I'll give you another example. This was work when I was at MIT. I did between MIT, Harvard, and Brigham and King's College, where another fundamental aspect of your life right now is, next slide, that nitric oxide is getting released in your body right now. When you exercise, when you move, the movement of blood, as Dr. Prabhakar is showing here, through your capillaries, releases through a very complex set of molecular processes. We release nitric oxide. It's a mechanical process. The flow of blood hits a structure called the glycocalyx, and through mechanotransduction, that blood flow shakes the glycocalyx, and then it releases a enzyme called endothelial nitric oxide synthase, which then, through a series of many, many complex molecular machinery, results in NO. Now, nitric oxide is critical to maintaining blood pressure, health, etc. It was the basis of creating a drug called Viagra. Now, if you go look at the literature, next slide, you will see many, many different narratives about nitric oxide release, okay? The problem is not any one of them is true. You have to take a combination, you have to take a systems approach, but no one knows how to combine these because it's too complex. Next slide. However, with CytoSolve, we're able to decentrally, next slide, combine them, calculate the output quantitatively without killing animals. Next. Now, does this work? Well, here's an example of what we're predicting of how much endothelial RNA will get released. That's our prediction. And then at the lab at Harvard, one of our postgraduate students, next slide, he did the actual wet lab research. People always want to know, is it true? Okay. And you can see the in silico results, and you can see the in vitro results. Okay. Next. Next slide. Same thing here. Next. So you see that this is not a curve fit. It is literally, we're able to use this approach to model reality. And again, this was a major breakthrough. This was published in the second, probably most important journal in the world called Cells, Biophysical Journal. All right. So these were important papers because we went head to head with the biggest institutions in the world, and we proved this technology works. Next, which there were a lot of names. Here's an example of a company that's a biotech company. They were working on a rare disease, and they spent about $100 million on killing a lot of mice, but they were afraid to go to human trials. Next. And they have a high level phenomenon of how edema takes place, typically affects women, where in the plasma, contact activation leads to bradykinin, which is a protein metabolism. Next slide. So if you look at the left slide here, the target that they had discovered that affects bradykinin, we had mathematically modeled that blue line. After we did this work, then they gave us the data of all the mice that they had killed, which is on the right. And you notice we match pretty well, okay? However, behind our line is the actual mechanisms, which most of these guys don't know. They're just sort of shooting in the dark. Now, they were kind enough to give us a press release, which again, further validates, next slide, our work. Like basically they said the only reason they decided to move to human trials was because our research showed that how it worked and why it worked. Thanks. And then finally, I want to share with you something where we literally, next slide, in the area of cancer, this paper came out about 10 years ago, saying that if you're going to solve cancer, you have to use combination therapy. So in the world of pharma, they're realizing they actually need to use natural compounds, but they don't want to use natural compounds because they're not going to make money. So their goal is, oh, just combine a lot of drugs together. And that's called drug cocktails. But if you do combinations, let's say you have 4 drugs you're going to combine with 100 different dosages for each. Well, that's 100 times 100 times 100, right? Times 100. That's 10 to the power of 8. Close to 100 million combinations. Well, how are you going to figure that out? You'd have to kill trillions of animals. But with CytoSolve, we can figure this out. Now, what's interesting is, Prabhakar, can you hear me all right?
Yes.
Okay. So what's interesting is we don't know any of the authors of this paper, no inside job. Next slide. But my thesis, next slide, was the only thesis cited in this paper, CytoSolve, saying that this would be the technology that could solve this. So when this came out, just as a lark, we weren't even doing any cancer research. We said, wait, why don't we mathematically model cancer? And in 1 year, could we discover a combination of the existing generic drugs that we could combine just to show that we could do this, just as a proof of concept, and get it allowed by the FDA. Now, you have to understand, it typically takes 6 years to do that. And can we do it in 1 year? And that's what we ended up doing. We used CytoSolve, next slide, to combine 270 different combinations, and again, of existing generics, which are off patent. We modeled all the pathways of cell death, metastasis, how cells proliferate. And we took 2 drug combinations, all using the computer, next, and we discovered 2 drugs that lowered cell proliferation, increased apoptosis. Apoptosis is cell death. And so we figured one out, and then we applied for an FDA allowance, which means we're showing that those 2 combinations are efficacious. Within about 30 days of filing this, we got a call from the FDA. They said, what you're doing is 23rd century medicine. They gave us the allowance, and then we didn't know what to do. It was a big win. We did it in 11 months. And then we did a partnership with MD Anderson, who's very interested also in combining natural compounds like turmeric and other things. But again, we did this for pennies that would have taken other companies, hundreds of millions of dollars. Next. But this is, we're giving you all these to show that we've created a very powerful technology. Now, my interest has always been natural medicines. So now that we proved all of this, so no one can say that we're just smoking something or this stuff is fraud or it doesn't work. We published many, many papers, very, very, through a lot of very hard work. But my interest was always what my grandmother did. So here you see a guru or a yogi combining 2, let's say, medicines. Curcumin, which comes from turmeric, next slide, and let's say resveratrol. Well, how much did you use? Well, turmeric, we have gone through 6,000 papers, previous slide. and modeled all the molecular mechanisms of turmeric. Then we did resveratrol, which is the skin of red grapes or Japanese knotweed. And then we put those together and we said, well, how much should you do it? Well, again, if there was 100 different dosages of resveratrol, 100 different of curcumin, that's about 10,000 different possibilities. However, with CytoSolve, next slide, we can discover the right combination. And what we discovered was 3 units of curcumin, 2 units of resveratrol did better than just giving 5 units of either one. Okay? And we can do this all day long. Next. So when it comes to whole pet health, I have 2 dogs. I've always had dogs all my life. The issue is, these pet food companies just combine stuff. And someone just recently told me that no one really knows what's in a lot of this pet food. It turns out that, like if you go buy dog food, which has chickens in it, this person was telling me that when baby roosters are born, they just, this is going to sound disgusting, but they just grind all the roosters up because they don't want too many roosters. And a lot of that stuff is in pet food. So think about the combination of things in there. What is it doing to your pet? No one really knows. So given I, have always had pets and I love them, I wanted to see if we could find combinations of things in nature that we could use. So that's Sequoia when she was a puppy on the left, and this Geronimo. These are Native American Indian dogs. They come from up in the northern Midwest, but there are a few of these guys left. But when the issue was, next slide, what is it you can give them next that could support multiple systems, whole systems, joint health, which is their bone system, immune health, metabolic health, bone health, anti-parasitic, brain health, skin health, anti-cancer, and heart health. What are the things that could support all of this? Because otherwise you're going to be taking this and this and this. You could be taking many medicines, multiple supplements. So that led us to really start looking at this. And by no means are we done with this. We're just in the beginning parts of it. But the pet supplement market is around a $4.2 billion market. And you can see it's growing. It's about going to double since 2023 over the next 10 years. Next. So obviously people are into this, but a lot of the drug companies are, and these are the big areas that you see. Multivitamins. You can see where it's going. You can again see it's doubling. Skin and coat health, hip and joint, prebiotics, probiotics, calming, and others, right? So, but obviously the pre and po and the skin and coat is what a lot of people deal with. But these areas are going to be doubling. Next. So if you look at joint health, for example, the 2 supplements people typically look at are chondroitin and glucosamine. And we'll do another pet series on the work we've done on joint health that we did for the National Association of Supplement Manufacturers. They had us analyze a bunch of ingredients that are used in supplements for equine, canine, dogs. But we'll do that as a follow-up, probably like in July or August. But these are, for example, supplements for joint health. Next, the issue is, do they work? Next, anxiety. Typically, people are taking chamomile for animals or melatonin. Next, and then, Enterococcus faecium or Bacillus coagulans for probiotics. Next, these are the 2 of the ones. Skin health. Typically, you'll see a lot of these supplements throw flaxseed and fish oil. Is it good for them? Sometimes some pets can't handle fish oil. They get skin problems or flax, Next. So what we did with CytoSolve was we looked at a set of ingredients, and there's probably many ingredients. We looked at all the literature out there across many, many papers, analyzed them, understood the mechanisms of action. Next. And that resulted in this very important document that we did. We're about to publish this, but it's called Whole Systems Approach, and it's a systematic bioinformatics analysis. We'll probably put this up on our shop for those people interested in buying the whole report or getting it. but we just wanted to, without any fees or anything, just share with you the findings, the high-level findings. Next. So what we did was imagine creating a set of ingredients that could really affect all those areas. Next. So we knew we needed a synergy of compounds. So one of them was zeolite. Next. So zeolites are these microporous crystalline aluminosilicate materials. They're naturally occurring. What's interesting about zeolites, they affect skin health, they regenerate wounds, the reduction of skin reddening, acne and other skin problems, for example, in humans. They modulate the immune system. They induce IgA antibodies. They're anti-inflammatory, antioxidants. They control glucose, and they also prevent a bone injury. So you can see this is a multi-systems compound or a naturally occurring element. Next. So that's one thing that we knew was valuable. Another thing is diatomaceous earth. So what is diatomaceous earth? Well, it's a naturally occurring mineral compound. It's really composed of microscopic, some ways fossilized skeletal remains of the unicellular algae-like plants. It's an effective pest repellent, supports bone health, mineral density, and it also is known to increase bone regeneration. Okay. Next. The other thing is spirulina. Spirulina, so we're looking at these, again, very bioavailable foods. Spirulina is one of the most nutrient-dense foods on the planet. It's really powerful for skin health, anti-aging, hydrates the skin. Now, for each one of these, we could show you the molecular pathways, which we have in the report. It's anti-melanogenic effects, it's wound healing, anti-acne, and supports brain health. Next. Kelp. Kelp is, seaweed. There's many different kinds of seaweed, but kelp are the large brown seaweeds. And you can see the many health benefits: anticoagulants, antibiotics, it's antiparasitic, antihypertensive, and it helps control cholesterol. Again, it's a wide-ranging food nutrient. Then you have MSM. Now, MSM is in rainwater. Before we started doing irrigation, we used to get our food in the wild from rain. So we had naturally occurring MSM. It's not clear what the irrigation way that we get plants, but MSM has essentially been depleted, but it's a naturally occurring chemical. It's found in some green plants, animals, and humans. Antioxidant, anti-inflammatory, really prevents osteoarthritis, and it supports supports from getting neurodegeneration. These are the known research benefits. And you can see it's a sulfur molecule double bonded to two oxygen molecules with a methyl group, two methyl groups. So that's two CH3 groups. So it's in some ways, it's a symmetrical molecule, but sulfur is the key. Next. Red raspberry leaf. What are the benefits of this? If you look at insulin secretion, it has many, many polyphenols: cancer, blood clotting, fat loss, uterine health. But we're looking at the leaf, not the fruit. Next. And then we also have hawthorn leaf and flower. Next. Now, hawthorn leaf is also rich in nutrients. It's a powerhouse, but it benefits a number of things in traditional medicines, and it's been used as a food supplement for centuries. It supports, from palpitations, tachycardia, nervousness. This is sort of the calms things down. In Eastern medicine, we would call this kapha supporting, okay? Or what we teach in Truth, Freedom, Health, it's the thing that supports the balancing of the storage or structural element. And also prevents arteriosclerosis. Next. Fenugreek. Some of you may know what fenugreek is. Typically, if when a woman leaves her mother and marries somebody, the mother will give her about 4 or 5 different herbs to take with her to her new family. One of them is fenugreek. Fenugreek is always used in typically every Indian preparation. It's also used in China, and it was an Egyptian traditional medicine. It prevents lung congestion, supports indigestion, prevents baldness, hypoglycemic, hypolipidemic, and hypocholesterolemic, which means it alleviates cholesterol, and it supports fat loss. So fenugreek. Next. And then finally, turmeric. Turmeric is a rhizome. If you notice on the left, it is not a root, but it's called the root stalks. Now, there's been about 7,000 papers to date written on turmeric. Obviously, for pets, it's absolutely fine to take. It alleviates digestion problems, liver problems, skin diseases, wounds, cancer, osteoarthritis. And it's been used around 4,000 years in both Ayurvedic as well as Chinese medicine. Next. Hyaluronic acid. You notice on the left side is the structure of it. Acids have a very particular structure. They have what's called a carbon bonded to an oxygen and another oxygen. So Prabhakar moves his cursor to the left there. You'll see this is 1, 2, 3, 4 acids connected together. On the top left, you see a COOH group at the fourth circle on the left. There's another COH group coming to the middle right there. And then another one. It's got two COH groups, sorry. And so this is a very, very powerful compound, which has been known to support skin health, in fact, regenerate cartilage also. Next. So supports tissue rehydration, skin aging, anti-inflammatory, osteoarthritis, and it really supports the movement of water. And it's a natural substance found in the fluids of eyes and joints. There you go. Next. So what we've done is, and we're doing more research, but our view is that look at these. These are coming from the east. They're coming from the west. There's compounds from the sea, compounds from lakes, compounds from the earth, compounds in some ways, fruits, leaves. So in many ways, if you looked at the number of compounds across this, you're looking at, hundreds to potentially thousands of compounds in this. So it's really a very powerful combination of natural compounds, which is hitting all those multiple systems. Next. And so what we did was, once we did this research, we worked with a partner and we put it into a whole food supplement. Next. And you can buy it if you're interested. Next. The other thing you guys can do is, this is an example. You may want to find your own ingredients. Next. There's no, and we've made it very, very accessible, but we want to let you know that we've used CytoSolve to validate this. Now, some of you may say, hey, look, I want to try this and this and this and this and this. Fine. And we're not here to push any food or product. We think we've uncovered something that hits multiple subsystems. But if you say, I want to try this, this, and this, we have the CytoSolve platform for you to do citizen science. Prabhakar, you may want to put just in the chat, if any one of you are interested in ingredients that you want to do research, et cetera, you can set up a meeting with us and we'll help you figure out how to do that. Dr. Prabhakar will put up a Calendly link if you want to do that. But the bottom line is, this is an example of what we've done to support pet health by looking at these out of many ingredients. And there's probably other ingredients, but you see, we put together a combination that from our findings looks like it's a very potent thing for whole system health. You may find something. We have the underlying process and the mechanisms for helping people do that. We want to also start looking at natural combinations for all these other pharmaceutical drugs that typically our pets are given. Next. So that's K9701, but you notice it's a combination of many things. So one of the ways you can help is you can support this kind of research by buying our products. You can fund CytoSolve research. You can also become an affiliate to resell these products, but more importantly, you can actually use CytoSolve in the open science model. Another example, Prabhakar, is MV25. Prabhakar will play you a quick video of MV25. We've also used CytoSolve for human health. You've probably seen these educational videos we've done, but for human health, we looked at all of these kinds of ingredients, particularly in the area of joint health. And so we did this process. And what we uncovered was, in this case, two very ingredients from all of these natural ingredients, two compounds, I'm sorry, that have very powerful effects on joint health. And Dr. Prabhakar will play that video, and then we'll go. Prabhakar, make sure the sound is on.
Millions of people suffer every day from painful discomfort and swelling, but most pain medications come with harsh side effects, and many alternative supplements have little scientific backing. That's why we at CytoSolve created MV25. MV25 was formulated using the CytoSolve Computational Systems Biology Platform, a technology for precision and personalized health invented by Dr.SHIVA during his doctoral research at MIT. This formulation is the result of computing trillions of potential combinations of biomolecular interactions derived from thousands of peer-reviewed scientific papers published across 4 decades by 68 research institutions to discover an optimal synergy of compounds that downregulate biomarkers of discomfort and normal swelling.
Hi, I'm Barbara Ann. My hands would cramp up so that I couldn't hold cards or knit or crochet, and they would go like that. And I'd have to use this when I played cards with my grandkids, and I started taking that MV25. After a bit, I was able to hold cards in my hand, very, very little cramping, hardly at all anymore. MV25.
Hi, my name is Sandy. I'm a Taekwondo instructor. I tore my ACL during Taekwondo. I had a lot of pain and limited mobility. I've been taking the MV25 for about 6 months now. After the first week, I noticed a big difference. After the second week, almost literally no pain.
My name is Jeremy, and I suffer from a lower back problem. Hurt my back at work years ago, and I can go to the chiropractor, do all kinds of different things, and nothing seems to help. And I decided to try MV25. I didn't notice a difference immediately, but within a few days the pain went away, and it stayed away. I've continued to take it, and even when I do things that I shouldn't do, it seems to go away a lot quicker than it ever did before.
MV25 is certified clean, 100% non-GMO, made in America, and GMP certified for good manufacturing practices. MV25 is CytoSolve optimized, which means that this formula has been engineered to maximize benefits while minimizing toxicity based on current research curated by CytoSolve. As the science advances, so will this formulation. This is our promise. Order online at mv25.life. Consult your doctor before taking any supplement or medication and use as directed. MV25.
This is why I stopped shopping on Amazon.
So that's MV25. Again, those of you who are interested in exploring research areas where you'd like to look at a particular disease area or a functional area, we have opened this up again for people. So next slide, Prabhakar. So how are the ways that you can be part of this is, you can support our products versus going and buying other people's products, because this directly funds our research. Next. And this stuff, actually, you can hear many, many testimonials that it works. We have to be careful because when we go compete with pharma, we cannot make claims, but we can share with you the research. We did a video, if you came to the symposium last month, we went through all of osteoarthritis. Next. And by the way, K9701, go back to Prabhakar, everyone should explore it if you have pets. It literally comes in a powder form. You just need a little bit of it that you can mix with your pet's food. Next. So the way you can help is you can support our research. Next. We're doing research in a number of areas, but one of the key things is all those components we shared with you that are in K9701 are actually coming from indigenous medical systems people have talked about for thousands of years. So we respect those systems. There are the liberal elites who claim that they are against racism, but they're the same people who support big pharma. And in many ways, they're the racists because they don't really value these traditional systems of medicine. If you're really dedicated to fight racism, you can support CytoSolve and what we're doing. Next. The other piece is, we're dedicated to eliminating the need for animal testing. Even the NIH and the FDA both say that what you do in animals doesn't translate to humans. So we're unnecessarily killing a lot of these, creatures and putting them through a lot of torture. It's unnecessary. Next. The final piece here is we all need to recognize that a technology such as CytoSolve and the work that we do has taken us 16 years to publish many, many papers to validate this. So we've done that. But for us to grow, if we were to go down the big pharma path or the traditional path of getting funding, we're going to be caught in this incestuous web of science. Big academia, big publishers, big pharma, big government. Now, because I stumbled into MIT and I leveraged that, we were able to get our stuff out there. But the reality is that, after a while they catch on to you. They're not going to let us grow in that world, but there's 8 billion of us. And the only way to grow this is for you guys to get involved and take this technology out to the world. Next, from our last symposium, we just talked to an African researcher or citizen, actually. He wants to use CytoSolve to explore some of the African herbs, which have very powerful uses, but it hasn't been validated, which CytoSolve can validate it. Go to vashiva.com/open science. You can, in addition to buying our products, helps you, helps us, helps all of us. You can just directly go and donate. Next. And we have different research projects we're currently working on. These are some of them. There's many more. There's actually about 35 of them. The site needs to be updated. And you can directly support. You can give $1, $2, whatever you want. It's up to you, or you can give nothing and you can just come to our events. But when you donate to us, we give people next many, many different gifts. Prabhakar, that slide doesn't do it justice, but there's around 15 different gifts. We actually train people in system science. You get access to the entire curricula that we offer. So you can so the concept is every time you give us something, we give you probably 10 times more. Next. All of this, if you want, you can also donate to the International Center for Integrative Systems. Prabhakar, if you can put all the links in the chat, and those of you who want your tax deductions, you can get that through that. So you have multiple ways to contribute. You can directly get involved. You can, support the products. You can support the research. If you want tax deductions, you can do it there, or you can give it directly to our research institute. Next. We have a number of affiliate programs. You can come in and if you want to resell products, there's no multi-level marketing. We have people who just they love our products and they want to sell it. You can refer products, or you can refer companies who want to use CytoSolve. There's some really, really great companies out there, small businesses who have really good products, but they don't get the light of day because they don't have the science to back it up. Well, if you know such companies, we'll help them develop the science. Because if they needed to do the science, they'd have to spend tens or hundreds of millions of dollars. With CytoSolve, you can do it for 1/1000th of that cost. Next. Prabhakar, can you bring up those slides? Oh, by the way, yeah. So if you go to vashiva.com customer service, if you want to be an affiliate, you can go and fill out the affiliate application and you can get involved. Next. If you, and then submit it. Now, the other part is how can you help in product development? Next. You can use CytoSolve to develop your own new products. So those of you who say, hey, I have a product idea, or you know something is hurting people in the environment, you can come to us and we'll help you build, figure out if something in the environment is hurting someone. Like, let's say you want to file some lawsuits, we can help you do the science. But if you want to help build new products next, you can come to us. We'll do the same process and we'll help you build your product. Okay. Next, end to end. Next. And if you want to do that, Dr. Prabhakar is going to put a bunch of links and you can get involved in a 60-minute meeting with me and Dr. Prabhakar, and we'll guide you through that process. Next. You can also help by becoming a Truth Freedom Health Warrior Scholar, which means you get educated. Next, you can go to truthfreedomhealth.com, become a Warrior Scholar. Again, this is really for your benefit. You contribute a little bit, but you can start by coming to the open house, which we do every Thursdays. And this is a larger movement for truth, science, for freedom, activism, and for your own health. Think, fight, and heal. Next. We also have the Systems Health program. We have something tomorrow, Friday. Next. And you're welcome to come to there and become part and become a systems health educator. You can literally build your own sustainable business by doing health education from a systems approach. And you can RSVP to come to that. But the entire goal here is we want to create conscious human beings who want to stand up on their own 2 feet. They can think, CytoSolve, they can fight, Truth, Freedom, Health, and they can heal. Systems Health. Next. So we have the solutions. Next. So that was our work on whole systems health. Prabhakar, while I'm waiting for questions, can you bring up those slides, Prabhakar, that's in the thing I'm about to do on bee pollen? I'm going to be doing a video today on bee pollen and autism, probiotics. Again, a lot of this research we just give away to the public because we think it's important. But in that, Prabhakar, if you go to that slide set about the fraud and science that's taking place, if you can bring that up, you know, that set of the slides, Prabhakar, you know what I'm saying?
Yeah.
So I want to just mention to people that in about the last 3 years, there's been more and more evidence of how the billions of dollars, your tax dollars, have been being given to the large institutions, have literally been used to create fake science. So for example, this was an article that the president of Stanford, who was a biologist, had to resign because for 10 years he'd been writing just bogus research. President of Stanford, okay? On Alzheimer's research. Next. This is just a little example. This was about another professor at the University of Minnesota. For 16 years, he was photoshopping. He had photoshopped one of the most seminal papers where everyone followed. $3 to $4 billion went into this research. Nothing's happened to him. None of these guys, nothing happens to these guys. Next. Just like nothing happens to Trump. He actually makes 200 million. Crime pays, it seems like. Then this just came out in May of this year. Who fakes cancer research? Apparently lots of people. Cancer data is the latest sign of science's fraud problem. Next. And then here's something quite interesting. And this is what we talked about because there's this incestuous web. They all back each other up. Next. And then there's, next slide. What's interesting is some of the billionaires who've been funding this research are like waking up and they're saying, well, why are we funding these universities? Why don't we just actually take the professors out of these universities and do our own institutions? But they're still in the big pharma world, you see? CytoSolve is out of that world. It's not in that world. So we're a completely different paradigm. Next. So there you go. Thanks, Prabhakar. Let's go back to the other slide. So we want to let you know that we will keep doing these symposiums, and we're giving all of you the opportunity to support this work. We're creating, breakthrough products created for pennies, validated with the systems approach. You can support us by, using those products, but the other ways you can also support us by just, if you have money, donate to this research, or you can become a collaborator in doing research. If you have questions, you can put them right in the chat. Prabhakar is putting all the links. Any questions? Okay, let's go to Carol. Carol, how are you?
Great. Question is the advantage that everybody's using, for the fleas and all that. If they take this dog powder, would they still have to use that type of thing on their animal?
Yeah, well, this powder really helps the skin coat, the overall health. Believe it or not, we should actually do about Prabhakar, when did we do that with Dr. Dan? Remember him? Bug off. What was it called?
Yeah,
Bug
it
check.
was bug check, sorry.
Yeah. We actually helped Carol, a very small vet, very smart guy, who'd come up with something, but he didn't validate it. But we actually helped create a product or validate a product and gave feedback on something for fleas and ticks, Carol. Different area.
Oh,
Okay.
thank you. I didn't know that because I know
we
a
did.
lot of
Yeah,
people
this
have-
was like 3-4 years ago we did it. We should probably do a video on that, in July.
Where can I find the video?
We haven't done one. We did it, but we do one, and we totally forgot about it. We do so much stuff.
I know.
We'll do
I
one
know
in
you
July,
do.
Carol. We'll do it next month.
Okay.
Good, Prabhakar. Next question. Yeah, I totally forgot about that. But anyway, if you think about all the pharmaceuticals and all those things our pets have to take, we believe we can apply the same approach to pet health and find alternatives for them. All right, it's 12:19. As we close, just think about the fact that we want to really make this platform accessible to you. We're just giving you examples of the fact that over the last 16 years, we've created this platform. But in many ways, we're giving you guys the responsibility of figuring out how you may want to use this in different ways. Carol, do you have another question?
Yes, I do. I'm sorry, I pressed the wrong button, but if a human was to use this powder, would it hurt them?
Well, so there's something called human grade. Prabhakar, this is animal grade, right? Prabhakar?
Yes. Well, it is food grade. So I mean,
So
it's not labeled as human consumption, but it is made to the standards of human food.
Yeah, so off the record, Michelle takes the stuff, Carol, okay?
Thank you. I
She
appreciate
grinds
that.
it up a little bit more because of diatomaceous clay. It is food grade. But, if we wanted it, we don't label it as that, because if we wanted to do it, we'd have to do a couple of other things, okay?
Gotcha. Okay,
He's got
great.
a lot of good stuff for our collaborator in this. I mean, what did he say, Prabhakar? He's been taking it for what, 20 years?
Yeah.
Yeah. The horses, there's some very, very, very powerful pictures of horses, their fur and everything in horrible shape, and then what this does, because this really helps the gut also.
Are you able to give it to cats also?
Yes, so this is for pets, all pets, and the dosage would be based on their weight.
Okay, and it's $25 a bag. How many pounds is that bag?
That bag, one of the things is we did the packaging very simple, Carol. Prabhakar, what? I think that will last you like 3 or 4 months,
Oh,
Yeah,
okay.
it's so we've thought about repackaging it into smaller things, smaller.
Yeah, the smallest is 8 ounces for 25. The
Yeah.
largest is the 32 ounces for 75.
How many scoops does it have, Prabhakar, for a 25-pound animal? I think it's got like 100,
So
right?
there are one scoop is 5 grams, 2 scoops per 25 pounds body weight.
How about for a 70-pound dog?
75 would be 3 times, so that is almost 6 scoops per day.
And you said the bigger bag was $75, correct?
Yeah, and it is a pound,
It's a
and
pound,
that has 180 servings. That means
180 servings. That's good to know. Thank you.
yeah.
I'm sorry, I have so many
Yeah.
questions.
Yeah, what
I
we did was
know.
we went pretty generous, Carol. We gave a lot, but then we're finding some people just want smaller things. So that's if you go to on the site, we repackage it into smaller units for smaller dogs, so people don't just have to buy a lot and they don't have to spend as much.
Well, that was wise because of the way the economy's going right now. That was
Yep.
very wise to do. Mhm.
Yeah.
Okay. I'm sorry. I have a knack for business. I don't know why. I've been selling the MV25 Life to people for, I mean,
Oh,
I send it out to
you know
them.
that. Okay.
Yeah.
Well, Prabhakar, Carol, put your number right to Dr. Prabhakar, but he'll connect you up to Ken, who can help you with some affiliate programs we're creating.
Yes,
We're
someone
a
has
research
contacted.
institution. We've sort of stumbled into product manufacturing,
This is fantastic. We got to destroy the pharmaceutical market. I've been in pharmaceutical markets since 1996 in the medical field. It's sickening what I see to what they're
Yeah,
doing to
well,
people.
so we as a organization are limited in the number of people, right? Because we spent all of our effort in building out the platform 16 years. Now we want to scale it. So in order to scale it, we decided we're going to stay true to our principles, which is to let you guys get involved.
Correct. I get
Bottom.
it. You're branching out is what you're doing.
Otherwise, if you want to go raise money, you have to sell out to the highest bidder, and we don't want to do that. So our only solution is our whole truth, freedom, and health model is bottoms up. So
That's right.
it actually led to it that we should make the technology accessible to you guys, and then you guys can directly support it. That's where we're at. Thanks, Carol.
Gotcha. Thank you all. I'm sorry I had so many questions, but you answered a lot. Now I'm going to go tell people. Thank you.
Yeah. So Prabhakar, make a note of Carol so Ken could
Yeah.
touch base with Carol. Okay.
Yeah.
Thanks. Thanks, Carol. Okay. Let's go to Barbara and Doris. We have about 5 minutes left. If Dava and Doris, if you can put your right in the chat, then we can sort of do efficiency and answer your questions right together. Barbara, go ahead. Doris and Dava, just put it right into the chat, right to Dr. Prabhakar. Or Barbara, if you could do that, then we can do it all in one shot. So Barbara says, I sent you a question. We don't see it, Barbara.
Yes, I think
Oh, there it is. Go ahead.
I have responded to Barbara's question.
Okay. What was it? Is it a
She said my best friend Booger, 15-year-old, has arthritis and his kidneys have started failing. I am giving him the supplement from Canadian holistic vet, Andrew Jones. I use diatomaceous earth for fleas. We are in deep woods. I'd rather buy a product from you. I had sent her the link for the product.
Okay.
Marin Yarbrough has a question saying, how do all the ingredients combine into a white powder?
How do all the ingredients, it's not really white, it's actually a
Yeah,
light green. It
right.
may not look that, but it's a light green.
Dawa says she is in a conundrum with cat and dog food. I think she's asking for any suggestions.
Oh, new type of cat and dog food? Yeah. Yeah, I mean, Dava, the big thing is this is a broader issue. These animals have been taken out of their quote unquote natural surroundings. And now we have them in these domesticated surroundings. It's true with when we went to visit one of the horse farms, when we walked into one of the vet's offices, Prabhakar, we just want to find a picture of one of those horse things, right?
Mhm.
Whatever the horses eat or whatever animals eat, they're not eating their natural stuff. So we have them in these, we like our pets. We don't live in our quote unquote natural environments. These are our natural environments. So it's very difficult, frankly, Dava. You have to unfortunately experiment. Some animal, I mean, chicken is not chicken anymore, and turkey and these things. It's all the food source because most of the chicken gets fed GMO soy to eat, and you are what you eat. So when you look at the food chain, these animals are not getting, they're getting essentially stuff that's not even in their natural natural food, sources. So some people try raw food. That seems to work for some dogs, and others will say there's high bacterial content. So there's a lot of controversy, reality, in all of this food. Our dogs, they were getting, we give them the supplement, but we had to switch them over to lamb, and they seem to do much better on that. So part of this is no vet really has the answer. The good vets will tell you you have to try different things. Some dogs do well on rabbit, but chicken apparently is one of the most highly allergenic ones to dogs because of the source of the chicken, where it's coming from. So that's the short of it. That's why when we created this supplement, it was to really support the missing things in these animals' diets. All right, everyone, it's 12:30. Get involved. Again, the key things, go to truthfreedomhealth.com, come to our open house, come Friday, support what we're doing. And obviously you're all welcome to come to the,
So Dawa is not able to unmute.
Yeah, we're wrapping up anyway. I think we got
Okay.
yeah.
One more question before maybe we can wrap up. Is from Marin. She's asking about the taste.
The taste, I love the taste. If you open it up, you can talk to people. Jenny Smith, I don't think Jenny's here. Jenny's got a couple of dogs. She loves the smell. It's an interesting. I don't know how it tastes like fenugreek. When I smell with Prabhakar, it tastes more like fenugreek. It has a very natural, sort of grounded smell to it.
Right.
Yep.
All right. I think let me just make sure writing this. So he's asking about. I'm sorry. Doris is asking about the cats, and the proportion. Doris is 2 scoops for 25 pounds. So we can do a quick calculation. If you want, let us know what your cat's weight is. We can definitely help you.
Yeah, Doris, just put your cat's weight and we'll calculate for you. All right, everyone, we have another meeting to get to. We wanted to do it in 90 minutes, but thank you. I mean, one project we could do, to Dava's point, is maybe we should look at different foods, Prabhakar, the different off-the-shelf foods, what they have, and allergenic inflammatory effects. You see, because most of this comes from inflammation. See, with CytoSolve, we can run different products through it and analyze them. It just takes us a little bit of effort. So we could, maybe we have a model where you could say, hey, analyze this product, you know? We create a site, a consumer-friendly site for all of our people. We can do stuff like this. So if you guys have ideas like that, let us know. But we have a very powerful technology. It's validated. We can use it in many, many different ways. All right, everyone, thank you. Thank you, Prabhakar. Thank you, everyone.
Thank
Be well.
you.